I want to touch on what's being discussed very hotly and very much the last few weeks, and that is the issue of a public plan option. Okay? How many people have heard of this already? Okay, good. So, for those of you who haven't heard about the public plan option, basically it's a government-funded insurance policy that will sit next to these private policies in this National Health Insurance Exchange. It will hold similar minimum comprehensive benefits. It will probably have co-pays and premiums with it, and it will be funded through the government. So it will be similar to Medicare in the fact that you can take this policy, go to your local doctor, and the clinic or the hospital will charge the public plan nationally for the funding and reimbursement. But there may be some cost sharing as far as some co-pays or a low premium, etc. And that's all being debated. Now, the reason why this is an extremely hot topic is, on the one end, people who are in support of the single-payer system or more government involvement in healthcare, government funding of healthcare, think that this is at least a possible option or a foot in the door, as opposed to privately for-profit, corporate-run insurance delivery. And so there's a lot of people on the Democratic side that are pushing the legislators to include this option in order to counteract the privatization of healthcare. You see. Now, on the other hand, this is being fought very hard by conservatives because this is seen as a government-run healthcare system next to private policies. It's also seen as creating an unfair playing field, letting a government program try to compete with other private policies. And there's been some studies that show that if the doctors participate in this public plan, that most enrollees will gravitate towards this public plan, and these private plans will lose enrollees, and companies will fail, and the private sector will disintegrate. Okay? And you'll see the comments from the conservatives accusing this as a Trojan horse for a single-payer plan. Okay? That they think this is a conspiracy from the Democratic side to get a foot in the door from a public plan perspective, and that this will eventually turn into a basically expansion of Medicare or publicly funded insurance. Okay? Let me just discuss the pros and cons that people are arguing on this public plan. And I'm not going to push it in either direction, but I want you to be aware that this is being very hotly debated, and if you feel strongly about it either way, you should tell your legislators about it. Okay? First, if the public plan is introduced on a national level to compete with these private policies in this National Health Insurance Exchange, it's going to gain some advantages that are seen in a single-payer system or in a Medicare-type plan. Let me give an example. Medicare is extremely stable. It's been around for 40 years. You enroll in it automatically when you're Medicare aged, and it doesn't change. Your benefits are fairly consistent, and it's been around for 40 years. Now, the argument is it's going to fail pretty soon because healthcare costs are going to crush it. Okay, that's another debate. But they're seeing an advantage of stability and security in this kind of a system. Secondly, the eligibility is uniform. You automatically enter Medicare because of your age. It's not because you're healthy or because you're not healthy. It's not because you make so much money or because you work a certain job, etc. A certain group of the population automatically are enrolled, and there's some comfort and consistency with that. Let me contrast that to Medicaid, which is state medical assistance. Now, some people in Wisconsin would qualify for Medicare. They go to Missouri, and they wouldn't qualify even if they cut their income in half for Medicaid. So some Medicaid systems in certain states are extremely tight and very restrictive, and some are very generous. And actually, fortunately, Wisconsin is one of those more generous medical assistance states. So you can see that there's not any uniformity in the state level, but if you have a national